Hi, my name's Heather. I'm a physical therapist with Breathe Physical Therapy and Wellness, and I'm going to review one of my favorite products for during pregnancy. So today I'll be reviewing an SI belt. It's specifically called the Serola belt is the brand, and I wore it with my second pregnancy, and it really helped with a lot of specifically the SI joint and pelvic girdle pain that I had. Especially mid to end of second trimester and all of third trimester. So first of all, I'll tell you a little bit about what the SI joint is. So this is a pelvis, a female pelvis, and the SI joint is where the ilium connects to the sacrum. That's why it's called SI joint. Here's your lumbar spine. Typically it fits together like a glove, and you can't see them here, but there's tons of ligaments that support this area. However, during pregnancy, the hormone relaxes and softens these ligaments to allow for you to carry baby and deliver baby. But that can also lead to more pain and feelings of instability in this region. So that's what the SI belt is for. It's not something that is going to make you so-called like addicted to it. It's more just something that's going to help support your pelvis, and it actually can help with better muscle activation, especially through your glute muscles, which is hard to do, especially towards the end of your pregnancy. So I'm going to demonstrate wearing the belt, and I like this one by Serola because I tried a couple of them, and I felt like this one was the most stable one and helped me the most. I typically wore it when I was walking, or if I knew I was going to be doing a lot of transitions such as sit to stand. And some women even find it helpful when they're sleeping because when you roll over, that can sometimes cause pain. Also, sometimes people have pain in that pubic symphysis region right here, your pubic symphysis, because again, that ligament there is also relaxing too. So this can also help stabilize that area and decrease some of that pubic bone pain. So when you put the SI belt on, you want to actually put it right over that SI belt instead of higher. I'll put it on here. So I'm going to put it right back, right where that SI joint is, and I'm going to bring it around like this. Now, the nice thing about the SI belts are that they have these nice SI locks that tighten, so you can pull it tight around that SI joint. Come over here. So you can pull it tight and you'll feel more stable this way. Some people like to wear them postpartum as well because there's still that relaxin hormone in your ligaments too. But I found this very helpful for pain management when I was pregnant. So again, that is the Serola SI belts. Give it a try. We have them here at Breathe to try out. Some people love them and some people don't find them helpful, but I found it very, very helpful, especially during my second and third trimester pregnancy.